Hey there, it's Dr. Joe Tatta. Thanks so much for joining me for this free masterclass today on acceptance and commitment therapy for chronic pain. Let me share my screen and then we will get started. On today's masterclass, we'll discuss how to break the cycle of suffering and chronic pain by using acceptance and commitment therapy. And when you use this type of model for human behavior and human suffering, it will help your patients drop the struggle with chronic pain, reduce the fear they have around chronic pain, as well as fear-related anxiety, and of course, help them reclaim a rich, full, and active life. There's just one aim for this webinar today. It's for you to understand how to use acceptance and commitment therapy for the treatment of chronic pain, regardless of any prior training or experience you may have, and regardless of the type of practitioner you are. So whether you're a physical therapist, an occupational therapist, a mental health provider, a physician, a health coach, a nurse, you are in the right place. This little picture of the fear avoidance model points us in the right direction as to how we can effectively treat chronic pain. So if you're a physical medicine professional, you're very, very familiar with the vicious physical circle of chronic pain, that fear avoidance that leads to progressive deconditioning, more pain on top of it, more deconditioning, and you're stuck in that cycle. However, with the biopsychosocial model, we realize that there's also a vicious psychological circle that patients become trapped in. And unlike that vicious physical circle, which you can physically see deconditioning happening. That vicious psychological circle is what's happening inside the skin. So you can't see the anxiety that's building up in someone. You can't see fear. You can't see anger. You can't see sadness or depression. And when all those different types of mood changes happen, that's where suffering happens. And this is where we can effectively begin to incorporate this into our physical therapies and make it a complete biopsychosocial intervention. Now, when we're talking about treating suffering, we're really talking about the psychosocial aspect of chronic pain. If you are a physical therapist or another physical medicine type professional, you're probably most familiar with pain education, or what used to be called psychoeducation many decades ago when I first started treating patients. That's probably the most common treatment that we're familiar with as physical therapists and other licensed healthcare professionals. And that model, that psychoeducation or that pain education model, really grew out of traditional cognitive behavioral therapy. And the goal of pain education was to provide patients with information about pain that helped educate them and help change distorted beliefs and thoughts about pain. This format of teaching people about the difference between acute pain and chronic pain biology or chronic pain neurobiology and helping people reframe pain-related thoughts and beliefs is important. And there is some research, there's some significant research, as you all know, to support that theory and that model for treating people with chronic pain. So as PTs, this is oftentimes our go-to with regards to psychosocial care. Now, that model really basically said, if we can change people's thoughts and beliefs, then we can help them reframe what pain is or help them reconceptualize pain. And with that, there'll be some type of symptom reduction. So obviously, we hope for pain reduction, but oftentimes the symptom that's alleviated is either fear or that pain-related anxiety. So how have we been doing with this model for treating pain? Does it always work? And if it doesn't always work, what are our other alternatives? So this is an article from 2018 in the Journal of Pain Research and Management that specifically asked the question, how well do patients reconceptualize their pain following pain neuroscience education? So this was a study done on patients that had chronic lower back pain. About 12 patients underwent. Specifically in this study, it was Explain Pain, a type of pain neuroscience education intervention. And at the end of the study, they found that there were varying levels of reconceptualization. So out of the 12 patients in the study, 3 fully reconceptualized their pain. So basically, the explanations that the patients could give about their pain were expressed in the term of a biopsychosocial model or biopsychosocial cause. 3 subjects showed no evidence for the reconceptualization of pain. So when they were interviewed at the end of the study, their explanations for the cause of their pain were expressed exclusively in biomedical language. Basically, that pain neuroscience education, or in this case, Explain Pain, really had little to no effect. And then in 6 subjects, so for most people in the study, there was partial or what's called patchy reconceptualization of pain. So when they were interviewed about their pain, they used language that was consistent with the reconceptualization of pain, but they also still had certain thoughts and beliefs about the biomedical reasons that pain was caused in their particular situation. So this basically shows you that even with highly experienced researchers who are instituting pain education or pain neuroscience education into the treatment of patients, that really more than half, if not only 25% of those patients, fully reconceptualize pain. So basically, people are still left with thoughts and beliefs about what is the cause of their pain. Now, we know that pain education or cognitive behavioral therapies, which are along the same lines, traditional cognitive behavioral therapies that aim to change thoughts, they're often used in conjunction with other therapies. So specifically, other types of biomedical treatments like injections or surgery, acupuncture, dry needling, course medication, other types of physical therapies, exercise, manual therapy, all of that is oftentimes delivered in integrative multidisciplinary approaches. And that multidisciplinary approach to pain is still the gold standard. However, if I were to ask you, if a patient goes through an inpatient multidisciplinary approach to pain, where they're receiving physical therapy and psychology and occupational therapy and nutrition and nursing and medicine, what percent of those patients still report pain 10 years later? And the answer is many years later, even after going through interdisciplinary or multidisciplinary pain treatment, 85% of patients still report living with pain. So after all those different types of therapies that we're promoting, really what we've been saying is pain control comes first, then you get your life back. So in many ways, we've been putting the cart before the horse. You have to control pain first. You have to alleviate pain first. And once you control pain or alleviate pain, then you can return back to the life that you'd like to lead. So if I can use a little metaphor to describe what we've been doing, and you can use this with your patients, imagine that one day you're sitting in your living room and you hear a knock at the door, and you open the front door and you look down, and there's a little tiger cub that's sitting in a basket and it's looking up at you with those kind of big blue eyes. And you look around and you're looking for someone outside and there's no one outside. So what do? You pick up that little tiger cub and you bring him inside into your living room and you place him on the living room floor and you start to pet him and play with him and care for him, and you're having a great time. And then after a couple of moments, after a couple hours or so, that little tiger cub starts to meow. And you realize that that little tiger cub is hungry. So you go into the kitchen and you open the refrigerator and you pull out some bloody chopped meat, because that's what tigers eat. They eat meat. And you start to feed that little tiger cub some meat. And after a couple of minutes, he quiets down. Now, this happens day after day after day. Every day, that little tiger cub starts to growl and starts to kind of claw at you because it's hungry. And day after day, of course, that tiger cub grows and grows and grows. And now you no longer have a cute little tiger cub, but you have a full-grown beast that if you don't give it what it wants, it'll tear you apart. So what's the moral of the story there with regard to chronic pain? And I ask this not only of myself, because when I reflect back on some of the things that I've done as a clinician, I wonder about it. But I just offer you a moment now to notice some of the things that you're using in practice and the things that you're saying to patients with regard to pain. So the question is, can we really stop pain? And not only can we stop pain, but with regard to the suffering that's related to pain, can we really stop thoughts or change thoughts or control thoughts and beliefs related to pain? So ACT is an experiential therapy. So unlike pain neuroscience education or explain pain, it's not didactic, meaning you don't explain this type of therapy with your patients. You actually do exercises that help people experience things. So let's look at what I just mentioned before this, which was, can we stop thoughts or change thoughts or control thoughts? Let's experience this on our own. So rather than talk about the research, Let's do a couple different exercises where you can experience this. Okay, so the first one you can do right here in the comfort of your own home is I don't want you to think about a pink elephant. So for the next 30 seconds, so for the next about 20 to 30 seconds, I'm going to time you. Don't think about a pink elephant. And if you happen to think about a pink elephant, just note it. Just note the number of times you think about a pink elephant. Okay, starting now, don't think about a pink elephant. I'm timing you. You can think about other things, just don't think about a pink elephant. Okay, how did you do? What did you notice? Were you able to stop thinking about a pink elephant? If you're like most people's minds, the answer is probably no. And even if you were able to stop thinking about it for a little bit, it probably popped in somewhere along the line of your thought. And then how many times did you think about a pink elephant? Did you think about it once? Most people within an average of about 20 or 30 seconds will think about it at least 5 to 10 times. So it just goes to show you that we can't stop thoughts and we certainly can't suppress thoughts. So oftentimes, once those thoughts or beliefs are there, they're very difficult and hard to change or control. Okay, exercise number 2. Again, you can do this right in your chair. You don't have to have your eyes open or eyes closed. What I'd like you to do is think about the happiest moment of your life. Maybe it was your college graduation, maybe it was your wedding, maybe it was the birth of your first child. Think about the happiest moment in your life. I'll give you a couple seconds to identify one of those moments. And now, once you have that happy moment, I want you to delete that memory. So try really hard, put all of your effort behind it, use all of your force and all of your skills and all of your might. And I want you to delete that moment. How are you doing? Are you able to delete that moment? Probably not. So let's try this. So now I want you to find a sad moment, not the saddest moment of your life, but just find something that was a little sad. Maybe, I don't know, someone stole your bike when you were a kid. When I was 6, I had this bike. It was called Big Red, and I left it outside my friend's house and someone stole it, unfortunately. So kind of a sad moment for me. See if you can identify a sad moment and then see if you can delete that. So it's a negative memory. See if you can delete this negative memory. I'll give you a couple seconds to work on that. How are you doing? Now, chances are you couldn't delete the happy moment, and chances are you couldn't delete the sad moment either. So, what does it tell you? It tells you that once we've learned something, whether it's positive or negative, happy or sad, meaningful or not meaningful, it's nearly impossible. It's actually physically impossible to delete a memory. We can put new learning on top of that memory, but we can never delete a memory. So think about that with regard to pain. If someone walks into a physician's office and they point to that herniated disc on an MRI and say, this is the cause of your pain, will they be able to delete that memory? Chances are the answer is no. Okay, experiential exercise number 3. I'm going to flash a couple of things on the screen, so follow along with me. And what I want you to do with this exercise is stop your mind from problem solving. So stop your mind from solving the problem you'll see on the screen. Okay, ready? Okay, here we go. 1, 2, 3, 4. How many of you said 4? And were you able to stop your mind from solving the problem? Okay, let's try it again. So stop your mind from solving the problem. Ready? Eeny, meeny, miny. Did you say mo? Okay, let's try another one. If it hurts, maybe you said rest. Or if you're a good physiotherapist, maybe you said move. Let's try one more. Herniated disc at. For most of us, if you've been treating low back pain for some time, you probably either said L4, L5 or L5, S1. So what does this go to show you? What does this demonstrate? Well, it demonstrates from an evolutionary perspective, our mind evolved to solve problems, and pain is a problem. So, whenever you have pain, your mind is going to do what it does, which is think and run through all the different various ways how it can solve pain. Okay, experiential exercise number 4. This is a really great one and a really important one. So, with this exercise, I'd like you to do it with your eyes closed. So, if you're seated in a chair, just rest your hands on your lap and just close your eyes. I'll guide you through this. It's really easy. Okay, now with your eyes closed, what I'd like you to do is to imagine a lemon. And I really want you to see the lemon. So see the shape of the lemon, kind of that almond shape that a lemon has. Notice its bright yellow color. Notice the bumpy, shiny skin the lemon has. And then I want you to imagine you placing that lemon on a cutting board. So you have the lemon in your left hand, and in your right hand, you have a knife. And I want you to place the sharp part of the blade of the knife on top of the lemon and kind of hear it cutting through the skin of the lemon down through the pulp. And now you have two halves of a lemon. So hold one half of that lemon in your left hand and take a look at it. Notice the bright yellow outside, that white pith kind of on the inside, and then the flesh of the lemon. And then I want you to bring that lemon and bring it up to your nose and smell the lemon. And then I want you to stick your tongue out, and I want you to place your tongue on the lemon. And then you can open your eyes, and then just what did you notice happened during that exercise? If you're like most people, somewhere during the description of that lemon, either you could actually smell the lemon or your mouth started to water as you imagine tasting that lemon. Now, if you like lemon, you'll identify that as a sweet taste. If you don't like lemon, some people identify that as a sour taste. Either way, you probably started to have a physical experience of that lemon, even when it wasn't there. So it goes to show you that as humans, our mind has the ability, or we have the ability as humans, to experience something even though it's physically not there. So even though pain may not be there, so even though you're not physically harming yourself, or there's no tissue damage or injury, you can still experience pain just with certain descriptions. So what are we essentially demonstrating with all these exercises? What we're essentially demonstrating is that the mind evolved to solve problems, that when you have pain, your mind is going to think about pain. It's completely natural to think about pain and to think about ways to escape it, to avoid it, or to control it. Those thoughts are so normal, and that there's not a way for us to delete or change thoughts. There's no delete button in our nervous system, and there's no change button in our nervous system. All proven facts that are part of relational frame theory or part of the theory that is the basis and the foundation of acceptance and commitment therapy. So my question for you is, if we can't change pain-related thoughts or beliefs, and in many ways might not be able to change pain itself, then what if avoidance of pain is actually the problem? So what if the problem is not pain itself, that the avoidance of pain is the problem? So from that cognitive behavioral therapy model that was invented decades ago, there is a newer model called acceptance and commitment therapy that grew out of that traditional cognitive behavioral therapy model. And acceptance and commitment therapy is an intervention that uses mindfulness and acceptance-based processes along with commitment and behavior change processes to increase what's called psychological flexibility. So at the core of this model is psychological flexibility. And psychological flexibility is a way to train, it's a process to train people to maintain open contact with either unpleasant or unwanted thoughts, feelings, and memories, as well as physical sensations, but choose behaviors that are in line with your personally held values and goals. So basically what it's telling you is that as a human being, I can experience unpleasant thoughts and feelings like anxiety and memories and even physical sensations like buzzing or burning or pain itself. I can have contact with all of that that's unpleasant and unwanted, but I can still choose behaviors that are in line with my personally held values what's important to me, the purpose of my life as a human. Now, there are three components of this model of health of psychological flexibility, which are essentially a behavior. So it's the behavior of being open, being aware, and being active. So those three pillars, those three columns, if you will, of psychological flexibility holds up that entire model of health. So it's a behavior of being open, being aware, and being active. Now, embedded in each of those components are two processes. So under the component of being open, there are the two processes of acceptance and cognitive diffusion. Under aware is present moment awareness and self as context. And then under active are your values and ways you can stay committed to keeping actions that are in line with those values. So those are six processes that make up those three components. Now, those six processes are the core processes of acceptance and commitment therapy. And essentially, those six processes fold into that one, which is psychological flexibility, which we went through a couple moments ago. Now, the flip side of psychological flexibility is psychological inflexibility. And in essence, that's experiential avoidance. So basically, it means that you avoid not only your thoughts, feelings, and memories, but also your physical sensations. And when you start to avoid all those things continually on a daily basis, moment by moment, they restrict your behavior. And then you choose behaviors that are inconsistent with your personally held values or goals as a human. So that's the opposite side of psychological flexibility, which is psychological inflexibility. And essentially, this is where our patients with chronic pain are stuck. They're stuck struggling with the unwanted or unpleasant thoughts, feelings, memories, and physical sensations that go along with living with chronic pain. Now, when that happens, they choose behaviors to eliminate those sensations. So it could be taking an opioid, it could be sleeping, it could be distracting from pain, it could be meditating for hours on end. Even healthy behaviors like meditation can be a healthy behavior. But if you're using it as a way to avoid all of those unpleasant sensations, that's where the problems start to develop. So the flip side of those six core processes of ACT, which is psychological flexibility, is psychological inflexibility. And there are six parts of that, which is experiential avoidance, being stuck in the past or fear of the future. There's a values conflict, meaning people lose touch with their values. Instead of taking committed action, they take inaction in their life. They become attached to a conceptualized sense of their self being someone who only is someone who lives with chronic pain, and they become fused with their thoughts, which is called cognitive fusion. So all this may sound great, but the question may be, or you may be thinking in your mind, is symptom reduction and changing thoughts necessary for a return to function? Because in essence, all our traditional cognitive behavioral therapies explain pain, pain neuroscience education, traditional physical therapy has told us we have to reduce symptoms. We have to change these pain-related thoughts and beliefs. Then symptoms will decrease and then they can return to function. So my question is this necessary? So we have some really good research. This is from the Journal of Consulting Clinical Psychology, 2017, that looked at an interdisciplinary acceptance and commitment therapy approach to treating pain. So this was an inpatient chronic pain program where people received multiple types of therapies, but all the practitioners were trained in acceptance and commitment therapy. And essentially, if we kind of go down to the bottom of this, essentially what they found after the outcome of this, so after 3 months of measuring, that significant improvements in physical function happen despite decreases in pain or changing pain-related distress or what's known as pain-related thoughts. So because every practitioner in this program is trained in ACT, so they're trained in a way to help people notice thoughts about pain, but not necessarily change those thoughts or change those beliefs, these patients still had positive outcomes, even though we're not changing their thoughts and not changing their beliefs. Okay, now how do we do this? How do we do this as ACT-informed practitioners, where we use ACT as a form of psychologically informed therapy to help people overcome pain and obviously help them with their thoughts, feelings, and emotions? So a couple different ways. Let's do a couple of different experiential exercises here together so you can see what this is like. Okay, the first one, just with your eyes open, or you can close your eyes, either one, doesn't matter. With eyes open or eyes closed, just notice if you can see your flow of thoughts. So notice the flow of your own thinking. I'll give you a couple moments in silence now to see if you can notice the flow of your thinking. So just notice how you have thoughts. Even though you're doing nothing, you're just sitting there, just notice how thoughts are coming up without you prompting them. How that amazing organ, which is our brain, does exactly what it should be doing. It thinks. Just like your heart can beat all day long, your mind thinks. And it thinks and it thinks. Now just notice how some of those thoughts may be positive. And now notice how some of those thoughts may be negative or neutral. And notice how your mind can flip back and forth from one thought to the next without you prompting it. You may even notice that your thoughts kind of speed up. You may notice that they slow down. You may even notice that they stop, but then again, without you prompting them, they start back up. And then just take a moment to normalize that and just say, thinking is normal. My mind is normal. Thinking, all sorts of thinking, positive, negative, fast and slow, neutral, not neutral. It's normal. So we normalize thoughts of all types, no matter what the condition, no matter what the diagnosis. We don't believe that people have psychopathology. We don't believe that people are broke. They're just a little bit stuck. So just through normalizing the process of thinking helps people overcome or be with distressful thoughts. Okay, second exercise. Now that you can see the flow of thinking, second exercise, I'd like you to do this as an eyes closed exercise. So in your chair, rest your hands on your lap and just gently close your eyes. And with your eyes closed, I'd like you to bring your awareness down to your belly and just zoom in on your breathing and just notice how your body breathes you. Just notice how you breathe in and breathe out. And just spend a moment or two being with your breath, noticing how you breathe in and breathe out. Okay, now we're going to do a little visualization. So, in your mind's eye, I'd like you to imagine you're sitting next to a gently flowing river. So, just imagine a little stream or a little river that's flowing by, and you're sitting next to it. So, it's a nice, warm, sunny day, and you're sitting on a rock next to this stream, and you can feel the sunshine on your skin, and you can see the gentle flow of that stream as it flows downstream. And as you're looking at that little stream, every once in a while, a little leaf floats by. Just see if you can notice a little leaf floating by on that stream. And now, as you're noticing that leaf, I'd like you to notice your thoughts as well. And as you're noticing your thoughts, just name one. So maybe you're saying to yourself, hungry, or thirsty, or interested, or curious, or whatever it is that is coming to mind. The next time you notice that thought, I'd like you to place that thought on a leaf and just gently send it down the stream. So the next time a thought comes up, just name it and then place it on the leaf and send it down the stream. And don't push it down the stream, just allow it to flow on its own. Sometimes it goes down rapidly, sometimes it flows down a little slower. Just allow that thought to go on its own. And then once it's gone, just notice how there's another thought there. And same thing, just name it, place it on the leaf, and send it down the stream. And then again, another thought's bound to come up. Simply name that thought, place it on the leaf, and send it down the stream. And I'll give you about 10 seconds to practice on your own now in silence. Okay. When you're ready, you can open your eyes. I'd like to talk a little bit about the research supporting ACT for chronic pain, or supporting ACT for pain and ACT in general. So ACT's been around since 1986. It's not a new therapy. There are over 300 randomized controlled trials on all sorts of physical health conditions as well as mental health conditions. And specifically in the field or in the realm of chronic pain, there are 5. There's actually a sixth one, a sixth meta-analysis with positive results about to come out with regard to ACT for chronic pain. Just a quick review. I don't have time to go into every single study, but there have been randomized controlled trials in how ACT helps improve exercise tolerance in sedentary women. Oftentimes when people exercise, they don't like the way exercise feels, whether it's pain or whether it's sweating or whether it's muscles contracting. So really important for us as physical therapists. It's been studied in those with fibromyalgia, multiple sclerosis, and osteoarthritis of the hip and knee. So all these are common conditions that I certainly treat, and I know you treat as well in your practice and in your clinic. With regard to systematic reviews and meta-analyses, I'll just kind of go kind of big picture through some of the more important aspects of this. I'll share 4 systematic reviews with you here. Acceptance-based therapies have medium effects on both physical and mental health and chronic pain. Those are important because when you start to look at the traditional literature around cognitive behavioral therapy, typically they have small but minimal effects, but ACT actually has medium effects. So there's some good research building that ACT may be better than traditional cognitive behavioral therapies. It has a moderate benefit for pain-related anxiety and a large benefit for pain interference. So pain interference essentially is your functional outcomes with regard to chronic pain. And ACT showed significantly higher effects on depression and anxiety than mindfulness-based stress reduction and mindfulness-based cognitive therapy. Again, so when you compare it to the other therapies out there, it looks really good. There are significant medium to large effect sizes with regard to pain acceptance and psychological flexibility, which are some of the core processes of ACT. And then finally, ACT is a process-based therapy that fosters a behavior that represents one of openness, awareness, and being active throughout their life with a wide variety of methods, exercises, techniques. Specifically, exposure and values are big within the realm of acceptance and commitment therapy. So basically, what all the research points to is ACT is what's called transdiagnostic, meaning you can use ACT, and ACT applies to many different types of physical diagnoses as well as psychological or mental health conditions that our patients struggle with. A lot of physical therapists are excited about ACT because they've used things like traditional cognitive behavioral therapy or pain education. They've just found that it hasn't quite done the job. It hasn't quite taken their patients as far as they hoped it could. So a lot of professionals are coming to acceptance and commitment therapy as a way to deliver psychologically informed physical therapy. And this can be psychologically informed physical therapy, can be psychologically informed occupational therapy, it can be psychologically informed chiropractic or nursing, whatever it is. We know that when you mix the physical as well as the psychological, when we address those 2 impairments, that's the sweet spot. That's when people start to overcome their chronic pain. Just to go through some of the research, this is 2019 from the Journal of Orthopedic and Sports Physical Therapy, basically asking the question, how can physical therapists promote the self-management for people with persistent musculoskeletal pain? So what can we use as professionals to teach our patients to effectively help them self-manage their pain? So inside this study, within a self-management approach, physical therapists can apply principles of acceptance and commitment therapy. So we know as professionals, we can use these interventions, but is it effective? So a lot of times these interventions have been studied in very controlled research studies, but this particular study actually looked at using different types of cognitive behavioral therapy, including acceptance and commitment therapy for the treatment of chronic pain in a clinical setting. So outside of research, but these are practitioners in a clinical setting. And they found that physical therapists and other practitioners can use cognitive behavioral approaches in a variety of settings to produce long-term positive outcomes in their patients with chronic pain, in this case, patients with chronic low back pain. And then finally, or specifically within the context of acceptance and commitment therapy by physical therapists, this study looked at physical therapists who were trained in acceptance and commitment therapy, used it to treat patients with chronic lower back pain. This is a randomized control trial. They found that ACT combined with physical therapy successfully reduced disability better than just physical therapy alone. It was acceptable, meaning the delivery of ACT was acceptable by both patients as well as clinicians. And physical therapists could deliver this type of care with high fidelity, meaning they could be true to the ACT model for chronic pain, and they can deliver it in their practice for people living with pain. So there are a number of randomized controlled trials as well as systematic reviews looking at ACT and physical therapy. So when you combine them together, of course, you have a biopsychosocial model for treating your patients. So to summarize what you've learned so far on this masterclass today, you learned about the ACT model for chronic pain, the 6 core processes, and the model of psychological flexibility. We went through some of the studies, both the randomized controlled trials as well as the meta-analysis supporting chronic pain. You got to do some experiential exercises. You understood how the mind works, and you understand what type of exercises we can use to help people be with their mind and realize that thoughts are normal. There's no need to change or reconceptualize anything in our patients. There are lots of different ways to help them, and how finally how ACT can be used to treat many different types of chronic pain conditions, and how there are positive outcomes both with regard to physical function as well as emotional function. And then because part of our mission here at the Integrative Pain Science Institute is to look at what we're doing and evaluate the courses that we deliver and how professionals are using them in clinical practice, I ran a pilot study on the Integrative Pain Science Institute experience. So these were physical therapists who went through my training program on acceptance and commitment therapy and looked at perceptions of learning and implementing acceptance and commitment therapy for chronic pain or to treat chronic pain. So I evaluated the outcomes of participants who went through my course. And after about 80 participants, really the outcome is this. And I have a whole blog on this. You can read the entire study if you want. But the outcome really was that 100% of the participants reported learning foundational ACT skills necessary to implement into physical therapy practice that helped improve their psychological understanding of musculoskeletal pain and how they can treat it. 100% of the participants reported that it helped them implement a new approach to treating musculoskeletal pain. So it gave them new tools, techniques, and of course, a new model to treat pain. And then 95% of them thought it was useful in clinical practice. It improved their job satisfaction. And most of all, it improved job burnout. So oftentimes burnout is high in the fields of chronic pain management or musculoskeletal pain management. Lots of different types of physical therapists, as well as other health professionals, PTs, OTs, nurses, health coaches, have been through the program and use it for lots of different reasons. This is Susie Gronsky. She's a physical therapist and a pelvic health professional. She treats both men and women with pelvic pain. So she highly recommends, of course, and uses ACT in her practice to treat people with chronic pain. And she really found that after the training, the ACT approach shifted her focus away, and of course, her patient's focus away from controlling symptoms, and instead focuses on values and what the person can do, even if these symptoms don't go away 100%. And then Michael Zabala-Aquino, who is a doctor of physical therapy in California, who works in the chronic pain practice. He for years studied pain neuroscience education, went through the entire training program. And once he got it, he said, this really helped me inform my practice with regard to acceptance and commitment therapy. And of course, the concept of the willingness to feel discomfort or to be with discomfort and other unpleasant sensations in his patients. And he has a really good case study of a patient who had chronic migraines or chronic headaches from a traumatic brain injury. There were lots of triggers that she had that made the headaches or the migraines develop. Specifically, of course, as many of you know, light or flashing light is a trigger for people with headaches and migraines. And that after going through his ACT training, so he implemented ACT into a group program in his practice, that his patient was able to not only reduce all of her medication, but she was able to watch the fireworks on the 4th of July without fear of a flare up. So you can see how just something little like that. So imagine not being able to be with your family and friends on the 4th of July and watch something simple like fireworks that we all kind of take for granted. He was able to institute this into his treatment, and of course, to help this lady or help this woman with chronic migraines. So if you've been using things like traditional cognitive behavioral therapy, explain pain, or pain neuroscience education, ACT is a wonderful way to complement it. So when you place these two therapies together, these two models, you really have an excellent opportunity to improve outcomes and, of course, help people return to a rich, full, and active life. So, with that, it's my pleasure to invite you to join me in the Acceptance and Commitment Therapy for Chronic Pain course. Inside, you'll learn how to break the cycle of suffering and chronic pain and how you can use ACT to dramatically reduce fear, avoidance, pain related anxiety, and physical disability so your patients can reclaim a rich, full, and active life. You can click through, or you can go to the URL www.integrativepain-science-institute.com. As you know, the Institute is an inclusive institute. The course is open for all licensed and certified health and wellness professionals. So everyone from physicians to PTs to OT psychologists, mental health physicians, health coaches, fitness and massage therapists, everyone is welcome to join the ACT for Chronic Pain course. You can use ACT to treat any chronic pain condition, including those that you see on the screen, as well as the common comorbidities of anxiety, depression, and trauma. You can use ACT as one-on-one individual therapy, or you can use it in a group. You can use it, of course, live in your clinic, and then you can use it as part of your telehealth services. A large percent of the course is self-paced and is online, so you can go through the course at your pace. It's a 7-week course. So in week 1, we go through the nuts and bolts of the ACT model for chronic pain. That's the science and the theory. In week 2, you learn how to move people from avoidance to developing that behavior of being open, aware, and active. So in essence, we help them get unstuck and realize they're not broken. They can do things with their life. With that, we guide them towards values-based action. We teach them how to unhook and gain distance from their thoughts with cognitive fusion. Nurturing acceptance and building their willingness muscle is a big portion of what you learn in this course. Finally, present moment awareness and self as context. And then week 7, committed action. So people learn how to set their compass and move their feet toward what matters. Each week, you'll receive right to your inbox 2 hours worth of training. The training consists of audio, video, reading. There are PDF handouts. There are patient self-assessments you can use with your patients. There are quizzes in there. And of course, there's a clinician self-assessment so you can track your improvement as you move through the course and as you learn the ACT model for chronic pain. There's a little quiz at the end of each week. It's not too difficult. It's only 5 questions. Of course, that's meant to satisfy your CEU requirement, as well as to help you guide your learning through the course. And if you're a geek like me, a pain geek like me, there's optional study material at the end of the course, or actually through different parts of the course, so you can study more and learn more about certain aspects of the ACT model. And just today, for signing up for this masterclass, I'm going to provide you with 3 special bonuses only available today. So bonus number 1, at the end of the course, you'll be provided with an entire protocol manual. So you have a protocol and a manual you can bring to your clinic and guide your patients through an ACT protocol. We have a members-only VIP group. So this group is only for people who have joined the Acceptance and Commitment Therapy for Chronic Pain course through the Integrative Pain Science Institute. And last but not least, and most important, once a month, I hold a 90-minute live coaching and mentorship call. That's a live Zoom call where we can communicate one-on-one. We go through case studies. We go through experiential exercises and learning. And of course, you have an opportunity to ask me questions and to interact with your other peers and colleagues. So you can click through or go to the URL www.integrativepain-science-institute.com/act to purchase the course. The course is regularly $799. If you're watching this webinar today, I'm going to slash 20% off the price. So when you get to the checkout page, you're going to enter in the code IPSI20. So that's all capital letters, IPSI20 with no spaces, and it'll instantly slash 20% off the price of the course, and it'll bring the course down to $639, just for those of you who are on the webinar today. This course is fully approved for 20 CE units, so 20 continuing education units for physical therapists, psychologists, occupational therapists, and health coaches. The course is usually $799. Since you signed up today to watch this masterclass, I'm slashing 20% off. When you go to the checkout page, just enter in the code IPSI20 for 20% off the course, which drops it down to $639. So when you sign up today, you receive 20% off the 20 continuing education units, the 7 weeks of training, as well as the 3 bonuses that include monthly coaching on acceptance and commitment therapy. That's a live Zoom coaching call with me. So I, of course, want to thank you for spending this time with me today on this masterclass. I'm going to stop sharing my screen here so we can just chat on the way out here. Acceptance and commitment therapy has completely changed my practice. It's revolutionized the way I look at people with chronic pain and how I treat them, the stance that I take toward them. I no longer have to struggle with changing people's thoughts and beliefs around pain or around an MRI study or an X-ray. And it's really quite refreshing, because when you kind of encounter those situations when people don't change, it can be really frustrating. And that frustration is what leads to burnout in us as clinicians. What I can tell you is that ACT not only changes your practice, but it changes you as a person, because all of us, including us that are practitioners, we struggle with sometimes pain ourselves. We struggle with different thoughts and emotions and feelings in life, both in the clinic and outside the clinic. So I can't recommend acceptance and commitment therapy to you enough. Make sure you check out the course and check out the blog posts with regard to the outcomes that people had from taking this specific course with me through the Institute. And of course, if you have specific questions, just reach out to me. You can reach out to me or my assistant by emailing us at support@Integrative Pain Science Institute. So that's support@Integrative Pain Science Institute. Okay, it's been great spending this time with you. I'll see you in the program.